Meghan Marcum. I am a clinical psychologist at Orange County Psychiatry and Addiction Medicine, and I am broadcasting to you live from Newport Beach, California.
Woo-hoo!
Wanted to talk a little today about bipolar disorder and what exactly that means. It's a mood disorder, so that means it's similar to depression, although there's some differences, and there's some differences in bipolar disorder also. There's type 1 and there's type 2. So let's talk about type 2 first. It is less severe in terms of its intensity of symptoms. It has symptoms of depression a lot of the time, so feelings of low mood and difficulty with concentration sometimes, disruption in sleep cycles or appetite, feelings of loss of pleasure in life, sometimes hopelessness, sometimes suicidal ideation. But then on the other side, which is the opposite pole, so to speak, there are different symptoms. So there's mood fluctuations, and those can look like feelings of irritability or hostility or aggression. And they can also be sort of the opposite of a low mood, having more of a high mood or a euphoric feeling. And in type 2, the symptoms usually fluctuate. You have 3 days sometimes, usually that's the most of a period. Sometimes you can have mixed episodes where you're feeling irritable, one moment, and then also depressed the next moment. So that's bipolar type 2. Bipolar type 1 is more significant symptoms of the high mood, so you could have a period of a week where you're feeling very elated, very on top of the world, sort of superhuman. You really don't have much of a need for sleep, and you kind of have like racing thoughts and sometimes even grandiosity. On occasion, you might even have psychotic symptoms where you're, hearing things, voices, noises when no one else is around. There's nothing there to explain it, or big delusions, that you can rule the world, or things like that. So anyway, that's really what bipolar disorder is in a brief nutshell, and there's medications that are different from the way we treat depression to stabilize the mood. So we want to keep you not depressed if you're having those symptoms, and not on the other side where you're irritable or euphoric. We want to keep you balanced, and so mood stabilizers are usually the preferred form of treatment. Anyway, I just wanted to explain that in a little bit more detail because it's a term thrown out all the time when someone has a bad mood or feels upset. Oh, she's bipolar, he's bipolar, and that's not really what it means. So hopefully that clarifies a little bit, and if you have any questions, you can email me